This segment is sponsored by Advanced Medical Centers.
If you're at home right now and you're suffering from burning, tingling, or numb feet, and you want to kind of pay special attention to this next segment, we're going to discuss peripheral neuropathy with Dr. Jason Hurst at Advanced Medical Centers, and they also are using a MLSM6 robotic laser. Wow, I had a hard time getting through that, doctor. I'm glad you're here now to help us out with that. Good to see you again. It's been a while.
Yeah, you too. Thanks for having me on, Bill.
This is something that reduces pain in a very unique way, isn't it?
It's what we have is an actual treatment protocol or program that we do for peripheral neuropathy. A lot of patients or a lot of people in the country actually do suffer with, I believe the number is somewhere around over 20 million, suffering with neuropathy. And it's damage to the nerves of the feet or legs and also affects the arms and hands for some people too.
This laser that you've got, explain to us how it actually works. And it does work, and you've had great results.
Well, yeah, it's overall what the one we have, it's like you said, the MLS M6. It's a robotic laser. It's the only one of its kind. So it actually, especially in times like today with COVID and everything, it's allowing us to help socially distance a little bit compared to some of the other class 4 lasers out there. Because once we set the robot, we just leave the patient alone for a few minutes. But it works by reducing inflammation, helps with pain reduction, accelerates tissue repair and growth, increases cell activity, the ATP production, energy of the cell, opens up, kind of vasodilates the blood, the arteries and veins as well. So it helps to increase blood flow to the area that it's targeting, and that helps with circulation, which helps healing.
And this is pain-free. I mean, it's obviously there to relieve pain in a lot of cases, but the actual process, you don't feel anything, do you?
No, not at all. Even with the traditional class 4 lasers, they produce a lot of heat, but with this one being robotic, you don't even feel it at all. You just see the light or the red light, the aiming beam, in other words, shining onto the body. But ultimately, when it comes to neuropathy, not everybody is suffering with pain. So that's where it can get confusing. Most of our patients actually present with numbness, tingling, burning, muscle cramps, balance issues, and pain just happens to be one of the symptoms. Now, the laser and even some of the other therapies, again, it's an entire program that we do, helps more on a larger scale to not just fix the problem in the office, but we actually help by introducing different things that we send home to patients so they can take care of themselves in the future as well.
How long does it take before the people feel better, or does it vary in every patient?
It does vary based on symptoms. Patients that are dealing specifically with pain and like burning, they'll generally get immediate results as far as even on the very first treatment, they start noticing some relief. Some of the other like symptoms like numbness, tingling, stuff like that, it's more damage or not necessarily more damage, but damage to the nerves in a different way that the majority of people will always say that they get relief within the first 1 to 2 weeks.
Yeah, and when you talk to the patients afterwards, what kind of feedback or what kind of questions do you ask them?
Ultimately, it's the way that our neuropathy program works so well is we focus on 3 primary goals. We have to get circulation back to the arteries to feed the nerves. We have to work on the nutrition because most people with neuropathy symptoms, they also have some kind of nutritional component through the metabolic process within their body to where we just got to kind of balance the carbs and sugars. Over 50% of neuropathy patients are diabetic as well, so that's always a big issue. The other doctors a lot of times tell patients they need to change their diet and watch their lifestyle, but they rarely give them a true plan, and that's where we come in. We do things different. We also give our patients supplementation that helps to increase blood flow as well. And then the third component is what I consider one of the most important for the balance is we work on balance and coordination. Where years ago, we even created our own therapy program. It's basically a physical therapy book along with videos online for our private access to our patients to where it's, if you do the physical therapy, if you just follow the 90-day calendar in there, you don't even have to go to physical therapy anymore because you can take care of it at home. Literally doesn't matter if it's in the morning, afternoon, evening, it's on your schedule. All doctors that I've heard over the years, whether it's your family doctor, neurologist, the cardiologist, the endocrinologist, the rheumatologist, the cardiologist, the podiatrist, every one of these doctors, what they do is they give gabapentin and Lyrica because that's the standard of care for neuropathy. And they really do tell most people, or the majority, that there's nothing else that can be done for it.
Wow.
And so patients go home just kind of with no other options out there.
Well, there is something, and you found it, and you've been doing this for a while now, and obviously you've got some great results. Thank you for spending a little time and explaining all this with us.
Not a problem. Thanks for having me on.
All right. Dr. Hurst, we thank him for visiting with us this morning. Advanced Medical Centers is located at 11512 Midlothian Turnpike. That's Suite 402 right there in Midlothian. Please give them a call, 804-977-1000, and find them online at amcvirginia.com. And here's a special offer. The first 25 callers receive a free nerve damage screening. Virginia This Morning is coming right back after a quick break.